I'm Allison Schmaltz, and this is Maria Kintervik, and we are doing our presentation on home health nursing. So, first and foremost, why are home health nurses needed? Well, being that this is one of the fastest growing industries in nursing, home health nurses have become really important. They are able to give a wide range of health care in the home for injury or illnesses. They are also less expensive, more convenient, and can be more effective. And they're pretty comparable to that service that you could get in a hospital, for the most part. So, what are some of the benefits of home health, being a home, or for a home health patient? They can be in their own home. They have the ability to have their own visitors when they want their visitors. They can come and go as they please. They can preserve their dignity. They can use the restroom when they want without having a call or having just that one person there to help them. They can also make their own food choices as opposed to having to fill out a menu every day at a hospital or just being given what is available. And it's also safer for them. There's less cases of med errors with the nurse being one-on-one with that patient in their own home. There's also no risk of hospital-acquired infections. So, we're going to go over some teaching and learning strategies. So what the home health nurse is going to do is they're going to provide the patient with educational materials about their disease process, whether it be, healing from an accident or a long-term disease such as diabetes. They're going to make sure that they're giving the patient credible resources that they're going to be able to use, and as well as staying on that patient's level of education, making sure that the patient's able to understand the material that they are being given. How can you figure out how and where a patient is in educational level? Well, you're going to assess their educational needs as well as their readiness to learn. So many times when patients are discharged home and they're going to have home health care, they have so much coming at them and they aren't really ready to learn. It's just an abundance of information, and most of that's going to go in one ear and out the other because they're just ready to get home and ready to continue on out of the hospital. So, the home health nurse is going to come in and they're going to make sure that maybe what was given in the discharge instructions is really understood, and if it's not, then they're really going to go further into detail about things and help the patient really understand what's necessary from the patient's end and what's necessary from the nurse's end to make their time together most effective. We're also going to try to assess their resources, because if some of the requirements of their illness and healing require a lot of financial resources and they don't have it, then it's not going to really be effective. So we're going to develop a teaching plan with the nurse and the patient, and we're going to discuss what goals we want to face and overcome, and make sure that the home health care nurse is also aware of the cultural needs of the patient, making sure that she's not overstepping her boundaries or doing something that maybe that culture doesn't like. And then some of the teaching strategies that can be done are obviously the teach-back methods, such as if we're doing diabetes education and a patient's been discharged home on insulin injections. Well, the patient may have given themselves one insulin injection in the hospital, maybe none, and they really don't understand how to do the insulin injections. Well, we're going to, show them how to do it, tell them how to do it, and we're going to watch them do it. And we'll continue to watch them do it until they have become effective at it. So, types of home health care. First of all, home health care must be ordered by a doctor. It can be short-term, it can be long-term. It really just depends on the severity of the injury or the extent of the illness. They can be semi-independent, they can have chronic illnesses, or they can have acute illnesses. They do not necessarily have to provide 24-hour service. Home health nurses can help with activities of daily living, and the patient is also able to participate in their own care plan, which is really effective. and important to a patient because then they feel like they're involved in their own care. And I feel like that gives the patient some comfort. So next we're going to go over some of the pros and cons of home health care nursing. So a pro, and this is for the nurse. So pros for home health care nursing would be the flexibility. The home health care nurse can pretty much make her own schedule to an extent. It's one-on-one in a private home setting. It also gives the nurse a chance to utilize her skill set or his skill set as opposed to having to do it in a hospital setting. And it also provides a lot of autonomy. On the other hand, some of the cons. Along with the flexibility for the nurse also comes having to work her schedule around the patient's schedule and making sure that she's providing her care around the patient's appointments and other scheduled meetings that they may have. She also has to track her mileage, or his mileage, I'm sorry. There is a lot of documentation that comes with home health care nursing, and that can be a deterrent for a home health care nurse. Also, like when you're going into a house for the first time, you don't know what you're walking into, so that can be kind of scary. You know, it could be something that you are not used to, and you just don't know how to react. Safety, the cleanliness, and even pets can be scary for a patient. I'm going to hand it over to Maria.
So we're going to continue on with standards and scope of practice. So home health care nurse have to act as a professional as well as a companion to the patient. Nurses have to observe, assess, and also treat the patient. They are the ones that monitor the vital signs, medication reaction, mental status, and behavior. They also have to report to a doctor, family member, and interact with the patient. So they have to be really knowledgeable about the patient's disease, what to expect, what is expected of medication, and what side effects to watch out for. They also have to educate the patient as well as family members. So the care would range from wound care, IV administration, doing IM and sub-Q injections, as well as monitoring the health status of the patient and also communicating with the team. When it comes to educational requirements for home health care, associate's degree in nursing is accepted, which is usually 2 to 3 year degree. Bachelor's degree in nursing is preferable, typically 3 to 4 year degree. Home health care nurses do a lot of interaction with the patient itself, family members, doctors, case management, pharmacists, wound care, community nursing, and also providing a lot of education to a patient and a family member. Some of the skills and abilities for the that home health nurses need to possess are ability to utilize nursing process, a lot of time management skills, because you might be seeing anywhere from 1 to 5 patients a day, so you really need to have your time management down. They have to have precise and accurate charting abilities, reliable transportation, really strong communication skills, and strong assessment skills. While doing the research for this project, we came across some interesting facts. We found out that there are 12,200 home health agencies in the U.S., as it was reported in 2012. There's 4.7 million patients received some type of home health care in 2011. Approximately 8,818 RNs are staffing population in Florida for home health care. There are a total of 1,236 agencies who serve about 372,000 patients. Home health nurses may be responsible for some light duties. That was one of the interesting things that I found out. It's as far as cooking, cleaning, and doing laundry. So thank you so much for watching our presentation. We hope you enjoy.
And here are our references, if you can see them. Thank you.